This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Owning a pet has many benefits. It can ease stress, ward off loneliness and depression, and encourage social interaction. For pet owner J.M. Tuazon, his dog Mickey has always been his constant companion and source of affection and friendship.
When I first saw his picture sa sinihan, so talagang napasigaw talaga ako kasi sobrang cute talaga niya. He's like a stuffed toy, actually up to now.
But one day, he noticed something different about his furry friend.
Low energy, he was being lethargic again, and then there came a time na he wouldn't eat his food.
A few days later, JM found a tick on his dog and suspected that it might have been causing Mickey's unusual behavior.
We took him to the vet. We just wanted to ask why he kept on sneezing. Kasi as in, every minute he would sneeze. That's when the doctor informed us, your dog has ehrlichiosis.
True enough, Mickey was found to have been suffering from ehrlichiosis, a tick-borne disease that can cause bleeding, very low blood cell count, weight loss, pale gums, and can even result to death.
The best prevention that I would say would be to use tick prevention medication that you can apply on your dog.
In extreme situations, owners are advised to have their infected pets undergo blood transfusion, similar to that of Mickey's case. Currently, Mickey is still under medication, and JM hopes that his dog will recover soon. What are the most common types of pet diseases? What are the telltale signs of these pet maladies? What home remedies can you give your ailing pet? Find out the answers tonight on MedTalk. Joining us tonight is Dr. Nick Carpio, owner and resident veterinarian from Vets in Practice. Also with us is Dr. Edgardo Unson, president of Animal House Pet Clinic. Good evening, doctors.
Good evening.
Welcome to the
Good
show.
evening. Good evening. Thank you for having us.
Oh, it's our pleasure. Pet diseases. So
Mm-hmm.
let's talk about our beloved dogs first. What are the diseases that are common to all dogs?
Well, a lot of things are what you see first. So there are outside and inside. So maybe from outside, you can see ticks. And we saw earlier a clipping about a tick-borne disease. So that's the name called garrapata. So ticks, garrapata are the same. You have fleas. So that's the most common thing an owner will see because that's what you see on the body and that crawls around the house. Okay, it's very common. Right now, well, the Philippines is
Yeah, they're like cockroaches actually.
it's
Yeah, it's
12,
they're everywhere.
12 months of the year.
I was about to ask, is there a time or a certain months of the year where there are more ticks on our dogs?
Actually,
and then there's a time when there are no ticks?
In our experience, usually it's summer where there's a lot of ticks because the tendency is they become dehydrated because of the heat. So the tendency is they go out and drink blood from the dogs.
Oh my. And we were talking about the clipping. Let's talk a little bit about that. He found a tick.
And that was just one tick.
I was about to say,
one,
just
yeah.
one tick can cause
tick,
something like
yeah.
that?
Yes.
So
Why is that?
they are blood suckers, so they can cause anemia. But when they suck, they also transmit a parasite that destroys the blood. So you'll have all these low counts. Platelet counts, white blood counts are so low, and that causes the depression and eventually the death.
Yeah.
He was sneezing and sneezing, Mickey,
Yeah.
Jim's dog. Why was he sneezing and sneezing? Also just because of that one tick?
Yeah, because as what Dr. Utson mentioned, usually the blood becomes thin. Therefore, sometimes the blood will actually come out or excrete out of the body. So usually they sneeze out blood, sometimes they poo blood or even vomit blood. It's all at the same time, yeah.
It's very common to see nose bleeding.
Nose bleeding, yeah.
That's why probably he was sneezing because it was starting to irritate already.
And being a responsible pet owner, Jim brought his dog immediately to the vet.
Exactly.
You'll think probably it will be a respiratory, nothing of a tick-borne. So the first thing with sneezing, because yes, dogs sneeze, but you wouldn't think it's caused by a tick.
Immediately, right? Yeah.
Oo. So it's really good also to observe, no, the behavior of your dog, and if there's something that's
Yes.
off. I mean, I'm still there in that thinking that only one tick can cause something like this. It was there probably for a long period of time, causing
Not
this to happen
even-
to the dog.
I mean, immediately as soon as the tick drinks blood or lodges to the dog, they can actually transmit this larvae or this blood parasite called Ehrlichia that can actually do harm immediately. Well, there's an incubation period usually, but depends also on the immune system of the dog. If the dog is really, strong and healthy, probably it takes a while. But, these parasites are opportunistic parasites that they wait for the right time to attack the system.
And when the immune system of our dog or our pet is low,
Yeah.
then
There.
that's the time they're going to be there and
Yeah.
have their heyday.
And it could have been from previous exposure. So when he was young, he might have had ticks. So it came out much later.
Yeah.
So now he's under medication, and hopefully he's back to his usual playful behavior, like we saw on the.
Yeah, ticks are a
The
major
clip.
problem. It's like what Nick said. It's like cockroaches.
Yeah.
The one female that looks like a raisin
Yeah.
Yes.
can lay from 100 to 1,000 eggs, and that's
Yes.
only one.
Ugh.
So imagine having 10 of that.
Yeah.
Your house is full.
Oh my
Exactly.
God! And yes, you
Yes,
were
I'm
about
sorry.
to say, Doc
And,
Nick.
and actually, it's a misconception for a lot of dog owners thinking that ticks live in a dog. They don't live in a dog. They live in your house. Okay? They only
Okay.
go to the dog just to drink blood. And then they actually, when they're done, they go to the small crevices in your house and lay thousands of eggs. That's how it is.
And then it's a
Yes,
cycle. They go
it's a
back
cycle,
to your dog.
yeah.
Yeah, they call it the tip of the iceberg. So what you see on the dog is actually just a small percentage. The
Yeah.
rest is all,
It's all around you.
especially if you have a garden,
Yes.
they love
They love the
grass.
garden. So when you bring your dog out,
Yeah. That's where they get
that's where they wait for the dog,
Exactly.
and that's where they latch onto the dog. So
Ah, yeah.
Because we live in a tropical country, so it's unfortunately this is one of the diseases that tropical country will perpetrate. It will continue. You know.
So how do we
All
get rid of
season.
all these ticks?
Well, there are some chemical or protectants that you can use actually in the house. I usually advise dog owners to actually protect your house first. Of course, you remove the ticks, of course, from your dog,
Yes.
and then you protect the house. By protecting the house, and then you protect the dog at the same time, then all is good.
Can humans contact ticks as well? What happens to a human, just in case you
They
know?
can bite.
Good question. Yeah.
They can bite, but they won't latch on.
Yeah.
So once they know that you're not a dog, then they'll fall off. But they can bite.
Okay, so we've talked about ticks. What is another common disease among dogs? You mentioned when they're young, when they're
Right.
puppies.
Yes.
Is there a common disease? Puppies?
One common disease is actually a viral infection called parvovirus. Usually it hits puppies from like a month old to actually to 1 year old. Yeah.
Why this period?
Yeah, that's when their immunity is
Yes.
low, and it really it really attacks young puppies. So when they're above 1 year, they don't really get that.
Yeah.
It's an age factor.
It's a certain immunity that they have. But we encountered like even 10 months old dogs, you think they're already old, but they get parvo. Even though they have 3 vaccinations, they still get parvo.
It's a very fatal, infectious
Yes.
disease. That's why again, prevention is the best medicine.
Prevention.
But
But you mentioned that the 10-month-old dog already had 3 vaccinations and still contracted
yes.
parvovirus.
Again, it's also, since it's a viral infection, it also depends on the immune system of the dog. If the immune system is compromised, therefore this virus attacks. Yeah.
And what happens to the dog? What are the signs that the dog has parvo disease?
It starts out
parvovirus?
generally as a gastrointestinal. So you'll see bloody diarrhea. Well, the usual signs are always fever and inappetence.
Right.
Then it progresses to vomiting and diarrhea.
How do you know if a dog has fever?
Well, it's warm. You
Warm.
can touch the ears.
You can touch the ears.
Okay.
It's good to feel
Yeah.
the ears,
Okay.
the tummy
And
regularly,
yeah.
so you know what's normal and what's abnormal.
Right.
Okay.
And generally, you feel the body; it's warmer.
Yeah.
And the sign also is the nose will be very dry, not moist.
Yes.
So fever and dry nose.
And then they
Right.
have with parvo, they'll start vomiting,
Salivating,
and diarrhea,
diarrhea,
Non-stop.
bloody. Yeah.
and it has a very foul odor.
Yeah.
Oh yeah, I know
So-
that.
Yeah, and because they're like babies, they're so small,
Yeah.
so they dehydrate really fast.
Yeah.
So 3 or 4 can dehydrate them right away.
So you have to bring them immediately to the vet.
It's best
It's
because
best, yeah.
anything that's given orally, they'll reject it,
Yeah.
and will actually induce more vomiting.
Right.
Okay.
So the best way to actually rehydrate the dog or the puppy is actually to put the IV fluids
Okay.
immediately.
Immediately, not to wait anymore and try to do a home remedy
Yes.
in this situation.
Yeah, because
It's
it's
best to bring them
especially
right
for
away.
those cases with puppies,
Yeah.
it's very. I mean, that 1 day delay can cost the life.
Very, very important. Yeah.
Yeah.
Okay, so these are for dogs. How about for cats?
Yeah. Again, with cats, you also have ectoparasites. These are parasites in the skin. So you have also like fleas and fungus. Okay, and you'll say they have skin disease. You'll see patches of bald spots
Right.
and raw spots.
Okay.
And cats also get virus. They also get feline viruses.
Okay.
The most common is respiratory viruses.
So do they sneeze also?
Yes.
Does something come out?
With
of
colds,
the-
yes. Yeah,
Yeah, you can't even see their eyes because it's with all discharge.
Yeah. And to add on to that, ectoparasites or the parasites that you can see is actually common for cats is ear mites. So
Ear mites.
Ear mites.
Is that like the garrapata in dogs?
it's a microscopic parasite. You can only see it in microscope, but basically microscope. But
Okay.
yeah, you cannot see it. But once we see a dark wax on the ears, the first thing comes to our mind is already ear mites. So we just check it for the microscope.
Again, immediate need to be brought to the vet. Our
Yes,
cats when
and
we
it's-
notice these things.
Yes, and it's actually transferable also to other cats. So, and if in case you get to have that one in your skin, it's also itchy.
Oh my, so
Yeah,
it can
but
be,
you can wash it immediately.
So humans don't need to be brought to the doctor just in case they
not
contact
really.
this type of
It's more
disease
for
from the cat.
fungus,
Yeah, fungus.
like
yeah.
ringworm, and there's a disease also. It's another mite called scabies.
Scabies.
Which is also seen as a very itchy cat or an itchy dog. And you don't see it because it's microscopic.
Right.
So once the vet examines it and you see those mites crawling, that's very itchy, that goes to humans.
So sometimes kasi we see our dogs and our cats scratching and we think they're just being playful or just cleaning their fur or just
Yes.
being their usual playful selves. And
If you see a dog that's really itching, even at like 2 o'clock in the morning and it's not even like sleeping, then probably there's something wrong.
that's abnormal behavior
Yes,
already.
already.
We'll talk more about pet diseases, signs and symptoms, treatments when MedTalk returns.
Did you know that like people, dogs also suffer from cancer, diabetes, and heart failure? In fact, congestive heart failure, a condition where the heart fails to pump blood normally, is one of the top 5 canine illnesses that require professional help.
We're back here on MedTalk, still talking about pet diseases. We've talked about the common diseases in dogs and cats. I'm sure our viewers might have exotic pets. So let's talk about turtles.
Okay.
It's getting to be a growing pet. Because they're small, easy to maintain.
Yes.
Yeah. But it also comes with diseases.
So what diseases
Yeah.
do turtles come with?
Usually we counter is respiratory diseases in turtles, where when the turtle is actually in the clinic, you'll see that their eyes are actually closed, and you see nasal discharges. So, and then they don't want to eat. So we have to put a tube directly, stomach tube directly to their stomachs and feed them with the feeding tube.
Feeding tube, okay. How about iguanas or other reptiles?
Yeah, a lot of these reptiles basically is because the diseases start because of either too cramped places, too much handling, or they don't have the right maybe temperature or the right enclosures. So they call that husbandry.
Yeah.
So how you take care of the pet. So I encourage a lot of people who have exotics to read about it, no? Because it really depends on how you'll take care of it.
Right.
Reptiles, they can't control their body temperature. So once the place becomes so cold, also that's when all diseases come in.
Yes.
You talk about taking good care of our pets. Now let's go back to the dogs and cats. How is proper care and proper nutrition for our dogs and our cats?
Yeah. Well, it starts from the beginning, no? So once you get your pet, it has to start with a proper diet. So again, not everybody has the same depth of pockets, no? So we talk about premium dog food, we talk about home-cooked dog food. Okay. So there's a difference, no? Home-cooked dog food is not table scraps. Okay, so it's best not to feed tira, meaning hindi makain, yung like taba,
Like
you know.
buto.
Yeah.
Yung tinabi mo na sa plate
Yes,
mo
yes,
and then
basically,
you just give it to your dog.
There is commercial food, which is from all stages, from puppies, and you have small, medium, large breeds. You know, and there's all different breeds, and the giant breeds. So that's one. Then you have also those who want to use meat, rice, vegetables. You know, that's cooked food. So, but it has to start with the proper nutrition. Commercial dog food offers all of that already, and cat food. So it's
Balanced.
It's a balanced diet, and for first-time owners, it's best to just keep the pet on one type of food.
Okay.
They're not like humans that need, you know, may
Different.
ibang ulam.
Oo, kaya food pyramid, no?
You
They
have
need
to
the
stick to one.
vegetables, the rice, your milk.
Yeah.
And
They're creatures of habit, so it's just best to start with one and then keep on the discipline of feeding them at a certain time because you don't want them to be picky eaters.
okay. So they can be picky eaters and they can also eat the whole day
They can
if
be,
you don't remove their...
If you don't control it, yes.
Or if
So
you don't remove their food right away
Yeah,
after a
so-
couple of minutes.
right. So it's actually up to the owners to actually manage the food that you're giving. It's not the dog's fault. If you feed a lot, you know, or no. It's actually the owner.
Okay.
So that's
So how do we train the owner, so to speak? How do we train the owner to be more responsible and to be more mindful of how to feed our cats and our dogs properly?
well, again, starts with reading on
Reading,
this no?
reading.
And learning about the pet
Yeah.
you're about to take home. So if you have a big dog, they have special needs. One is budget, because the big dogs will eat up your your allowance. You know?
Yes.
You know, they eat so fast. They eat a lot. You know.
And do big dogs eat only once a day or twice a day? Or depending if they're still
When
a
they're
puppy?
puppies,
Depends.
you still feed
Yeah.
them on a regular, maybe 3.
Yes.
They start maybe at 4 times when they're really young. Then they
yeah.
become 3, then they become 2, then
Two.
eventually 1.
Yeah.
When does it get to that stage where they're only fed once a day?
Well, if you have a dog that is actually overweight, that's one thing, or obese.
My dog.
So, if you don't want to, you know, sometimes dogs, if they're used to the routine that eating twice a day
Yes.
is actually okay. So that one meal you can actually separate it in order to manage the weight of the dog.
Okay.
No, but once a day for Chihuahuas, Pomeranians, they're okay to feed them once a day because they don't really need a lot of food and energy to expound. Yeah. But for working dogs or sporting dogs, usually they eat twice a day or 3 times a day even.
Okay.
Yeah.
So aside from food, from shelter, from love and affection, proper nutrition, what else do our dogs and cats need?
Well, we stress on a lot of socialization, okay, because that's your new member of the family, and as you know, pets have invaded the bedrooms. So it's how you raise them. Okay, so if they're not used to people, or if they're the owner is very protective and they don't have a chance to mingle with people and with other pets, they don't know how to mix with others. So they can either become very nervous pets, or they can be either very aggressive pets. So it's best to socialize them with people and with other pets.
Okay.
And we also advocate, well, socialization doesn't mean just letting them go.
Yes. Yeah.
So there's a lot of discipline, training, and training, kasi, again, comes with different types. You have either dog trainers. A lot of people now are one-on-one.
Yes.
It's easy actually to train up your pet,
Right.
but it really takes the discipline.
Right.
The discipline of your pet and the pet owner as
And
well.
the knowledge, no?
And
You
the
should know
knowledge.
how.
Yes.
That's why
Patience.
it's very important that you buy a book.
Yeah.
And read. And
Oh,
I mean, the
and
YouTube.
read it.
YouTube
And
will teach you a lot.
There's also a lot of information. Like, of course, you guys heard Cesar Milan, the
Yes,
dog
Dog
whisperer, and
Whisperer.
everything.
Very
like that,
popular
yeah.
now.
Very
Yes.
popular. So you learn a lot from them also as well.
We have dog whisperers here in the country who
Yes.
can very well train and teach our dogs.
Right, right.
And bring their tempers down
Yeah.
when needed. Doctors, we have a Twitter question.
Okay.
My mother would always tell me that chocolates are bad for dogs. Is this true?
Yes, actually, it is. Usually, the darker they are, the more poisonous to their dogs.
What
no?
is it in chocolate that is
There's a
poisonous
certain
to dogs?
there's a certain enzyme that's called theobromine that they cannot digest this one, so that's why they have the really bad diarrhea.
Oh my.
Yeah.
Okay, so stay away from. If the humans are eating their dark chocolate, their favorite dark chocolate, their dog shouldn't be around
Yeah,
them.
it causes actually blood toxicity.
Blood toxicity.
So they get a lot of bleeding problems.
Okay.
It can be very fatal if they eat a lot.
Okay, so it also depends on the amount of
Amount
dark
and
chocolate.
Amount,
the
yes.
frequency if it starts building up.
What other certain types of? We mentioned chocolates that we shouldn't give, or accidentally the dog shouldn't eat these chocolates. How about other fruits maybe, or vegetables?
Well, macadamia nuts, for one thing, is actually also poisonous to dogs.
Okay.
We had cases like that when fed to a dog, even like 3-4 pieces can do something bad to the dog.
Yeah, grape seeds also.
Grape seeds.
Yeah,
What
because a lot of people like giving fruits.
Yes.
Right.
So when you give fruits, also be careful because the notorious mango can get lodged.
Yeah. Yeah.
Okay.
Certain fruits are also itchy. They cause they're warm, they're hot,
Yeah.
they cause diarrhea. But generally, like the grape is not given in big amounts,
Okay.
and just the seeds.
Right.
If there's one fruit that we can give our pets, our dogs and our cats, what would it be?
Usually I give apples. Yeah.
They like it, it's crunchy
Yeah.
also. It massages their gums as well.
Yeah.
Yeah. How about vaccines? Let's talk about the vaccination for our dogs and our cats. Let's talk about the vaccine first for dogs. What type of vaccine, how often, and what age?
There are different kinds of vaccines for dogs, and also different kinds of brands, in the market. But usually, what we use is the 5-in-1. It's commonly known as the 5-in-1. There are 5 diseases already that you can actually protect the dog from that 5-in-1 vaccine. And the yearly also is the rabies, which actually we discussed before. Yeah.
So the 5-in-1, how long does that last?
Yeah, you will usually, if it's an adult dog, you do it annually. There's also kennel cough vaccine. Kennel cough vaccine depends also if your dog is, usually you bring the dog to the groomers most often. So usually we advise every 6 months just to protect it from kennel cough.
Okay.
Yeah, these are for infectious diseases.
Yes.
So because again, our climate is very conducive, and a lot of people don't vaccinate here, so the diseases are very prevalent. So like in other countries who have winter, you don't have these diseases. And because a lot of people, other countries vaccinate, most of them are eradicated. So people are shocked when there is distemper here. Like, huh?
Yeah.
You have distemper?
Yeah.
We don't see that in our country.
Why is that? Why is it here only in
Because of the
Philippines or in
climate.
Asia?
The climate and the
climate.
number of population,
Yes.
that's, a lot of unvaccinated pets. So
Yeah.
it's a constant problem.
So in solving that constant problem, we should be, I should be a responsible pet owner, and all our viewers there, when they, have their dogs with them, they should be responsible to know and understand what their pet needs, wants, and the proper care for our pet. So doctors, any last message to our viewers on how to take better care or the best care given to their pets?
Well, prevention again is the best. Prevention, you go through, have a good relationship with your veterinarian. Just start with choosing your vet, and they can explain all the things that are needed for prevention. So don't see your vet only when you have a big problem, on a regular basis. And number 2 is also nutrition. And we also advocate because pets now, again, are members of the family, and you get a pet not to keep having puppies. So, and a lot of people now socialize their pets and bring their pets like to Eastwood, to Bonnie, to
Yes.
Bonifacio, So they call it neutering. Neutering is a very important thing that we advocate. A lot of people think it's cruel, but it's actually because you're changing the behavior of the pet.
Yes.
The pet is already an indoor pet, so it removes all the aggression. And one is also for health.
Right.
It prevents cancer, prostate cancer with men, with the female, with the male,
Male.
with the
Male
male, and also breast cancer because dogs have many mammary
Yeah.
glands,
Yeah.
and also infections of the uterus. And in general, it keeps the life longer, and you just have happier pets.
A happier pet is a happy pet owner as well.
Yes.
Yeah, just before getting a pet, you read on it first, think about it, talk to your family, because this is a team. It's a team thing, You have to talk to them that, okay, we're gonna get one. No, it's a team effort. So before getting one, you have to plan it first, and make sure that it's a lifetime thing.
Yes. It's a commitment.
It's a commitment. Exactly.
Just like how committed you are to your family members, you must be committed to this new
Yes.
family member as well.
Yes.
And pets live longer now.
Yeah.
We're seeing a lot of
Yeah.
I like
pets
that.
who
Right.
live up to 15, 16, even
Yeah.
20.
Yeah.
You know what? I'd like to talk more about this topic. Maybe we can have both of you again on the show.
No
So thank you once again to Doc Nick Carpio
Thank you.
and Doc Unson, Edgardo
you.
Unson. Thank you very much for your time and
Thank
for
you.
Thank you.
educating all of us on how to take care of our pets.
Our pleasure.
Our beloved pets.
Thank you.
Thank you once again, and we'll see you next Tuesday on MedTalk, 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.